All
All
right.
right, so Melvin Phillips, I am so happy to have you back on. And you were just at a conference, is that right? Because we're going to do something way darker today, but you very mercifully let me go on to something way easier for you to hang with today. So, what's your
Yes, we're going to
conference
talk
on?
about pleasure and something more fun. We're going to talk about sexy today.
Oh, thank God. I could deal with sexy today. That'll work for
We'll
me.
we'll do that today.
All right,
Yeah, we'll
let's do
talk
a quick
about
introduction for you because some people might not have been listening for a long time. So,
okay.
let everyone know
All
who you
right.
are and what you're up to.
My name is Dr. Melvin Lee Phillips Jr. I am a sex therapist out of Washington, D.C., and I'm working on my first book, Sex and Love When You Were Sick, which is in the proposal stages. It's going very well. And I specialize in treating chronic illness, chronic pain, and sexuality issues of concerns and disabilities. And I am very excited to be back on Invisible Not Broken. Monica and I decided that we were going to try to do a once a month thing for our listeners. And this is great. And sex is a big part of people's identity. And we want to really talk about how we can still function sexually and have a chronic illness, chronic pain due to a chronic illness. And yeah, things have been going really well with me. I just got back from the National Sexual Health Conference in Chicago, and I did a talk on reclaiming sexuality for couples with chronic illness. It went very, very well. A lot of great people in the sexuality world were there. Everything from, infectious disease doctors to nurses to public health people and to other sexologists and therapists. So the talk went really well. I had a lot of big people that are in the field come to my talk, which was amazing. One of them was the author of the book Come As You Are, which is a book about female sexuality, Emily Nagoski, who's
If you do
a
not
neuro-
follow Emily Nagoski, please go on to Instagram and follow Emily. She's awesome. That's like one of the things I always look for in my feed. It's fantastic.
yes, she was at my talk, and it was just great to have her there, and just great people, and to be able to share a topic that does not get talked about enough. And so, there's a lot of gaps in the research right now that show that yes, there are articles and books out there on how to treat chronic pain and chronic illness, but we're not finding a lot of research out there on what's going on in the relationship between two people that have a chronic illness with sexual issues of concern. And so that's really what my book is about. But people who are also single will benefit from the book as well because it's going to talk about, sexuality issues of concern and everything that you can do to be sexual when you're single. And that's what I'm going to kind of touch on today. So I really want to take the energy from the conference and be able to come onto the podcast and really
Man, I'm
get,
so glad one of us has energy. I will just like defer over to you. Go on with your good energy.
I'll
I
take
will
off.
curl up over here in a ball and listen.
Yeah, okay, we can do that today. I'm just really happy to be back on here and to really work with you again. And the thing that I really took, I think, from this, conference and what I'm gaining from my work is that it's really important to find out what works instead of focusing on what does not work. And I think that's a positive approach, and I think that can really increase pleasure.
So, what are some of the things
And
you found that could work? Like when you're conferences are awesome for getting a ton of new
yeah,
ideas. Like what
yeah,
what like
yeah.
sparked up your imagination? You're like, oh my god, I didn't even think of that, but that would totally work out.
Well, the one thing that really sticks out to me when it comes to talking about sexuality and chronic pain is that you really have to really, I think, when you have crushing fatigue and chronic pain, I think sex is one of the first parts of your life that fall to the wayside. And I think what I'm learning is that it does not need to. You can still be very sexual and have a chronic illness and have a chronic pain condition. And that penetrative sex is one form of sex. And
Mm.
I think we live in this culture still where people are always talking about orgasms and penetration. And if that's what the couple wants to do, that's great. But I think what we really do find is that sometimes that just does not always happen. We have to adjust sexually to other things.
That's
And
such an
that's one,
important point. I love
yeah,
that because, like, visually, like what we're shown over and over, and may I just say over one more time again on even network TV, and then if you look into any of the pornography, usually the first thing you'll find is that penetrative like idea. That's all that sex is. That's what what underlying
Yes.
sex equals. So I love that you're talking about something very different. Can
Yeah.
you, like, without getting too into the weeds where we end up like getting kicked off of whatever people are listening to us on, can you go a little bit into like what that could look like?
Well, I think, um, another thing to do is that yet sex, it's another thing to do rather than to experience to enjoy. I think we need to enjoy sex. But there is a good reason to find your way back into passion. I think a lot
Mm.
of people that have chronic pain, it really consumes you, right? So it's like you don't become very sexual anymore. And so not only does physical intimacy help you feel less alone, the research does show that a good orgasm can also ease your pain.
Yes, by 30%. I saw that.
Yeah.
I
I
saw
mean,
that statistic. I brought that statistic
yeah.
over to my husband. I'm like, look.
Yes. It's like, look at this. But there's been real evidence that endorphins released from orgasms can actually alleviate symptoms of pain and help manage chronic pain in general. And this is because endorphins, they block pain while enhancing parts of your brain that are responsible for pleasure,
No,
which
see,
I think is totally cool, you know?
I want to just underline something really quickly because I think that some people in relationships where sexual desire is different on one side of the couple than the other, a lot of times there's like a guilt thing of like, look, this would help me, look, this would make me feel better. And it's like, so both partners need to be committed to what you just said, orgasms or pleasure or joy in that sexual relationship. So you can't just go to
Yes.
someone and go, hey, make me feel better. Like, it's important for everyone to be concerned and interested in the other person's pleasure and comfort level. So I love that, you're really bringing up that idea of like, not just the end goal, like
Yeah, it's
connection,
not
help.
the end goal. What it is, and this is with couples that don't have chronic pain and illness, but I think for couples that do struggle with chronic illness, it's critical. It's about communicating what your needs are, and pleasure is the measure. That's one thing
Mm-hmm.
Emily Nagoski says. I mean, that's really what it is. It is just, what do you find pleasurable? What do you not find pleasurable? So it's really, sex at its heart is about communication. So it doesn't have to be about penetrative sex. It doesn't have to be about reaching an orgasm. It really is about that. So the science behind it, what I learned about, oxytocin, a bonding hormone that increases when we hug someone or when we have orgasms, may also have pain-killing effects. There was these researchers out of the University of Alabama at Birmingham that are doing some studies on that. So I thought that was kind of interesting. But I think what we have to look at is, how do you get in the mood and stay there so you can reap those awesome feelings that you want and to address symptoms? I think that's the thing that we have to look at. And one of those things is optimizing your treatment plan with, and I know how we feel about some medical providers, but I
What?
mean,
What? Who? What? Sorry, was that directed at me?
I know that we've talked about that before, right?
I've only talked about it on every episode. I don't know what you're
I know
talking
you
about.
have. I know. And
Sorry. Yes.
no. And what's going on with medications? Are there side effects that make you feel less sexy? And what can you do to feel more sexy, right?
Oh, thank you for bringing that one up. I really appreciate you like pulling that one out with the side effects can be anything from like gaseous to like really bad stomach problems to like mind caused vomiting, which really hot sexiness there, like nonstop vertigo vomiting. And there's also medications that can really change your sexual desire, your ability to even reach any sort of plateau because they just deaden everything.
Exactly. And so that really becomes an issue in my office. We talk about desire and arousal and how medications can definitely affect that. And so I always recommend, one of the things that I do in my office with a lot of my clients is we get that to-do list of the questions they want to ask their doctor. Because sometimes they're going into their provider, and I think I mentioned this before on the show, and they've got just a couple minutes. They don't have the time with their doctors like they have with me. And really getting that action plan together on the questions that they can ask their medical provider about medications and side effects. Because if we can tweak medications and you can have less side effects, hey, that's great. And that may help with being a little bit more sexual too. I mean, because the last thing that we find is that when you are feeling bad, I mean, the last thing you do is feel desire. But if some symptoms can decrease, maybe there's a little bit of room there for desire, right? And sex doesn't have to be spontaneous either. You can plan it with your partner, and it
Oh.
doesn't have to feel like a chore.
Thank you for that one too. I know we have very different lifestyles, but when you have like an entire family that you're responsible for, planning it is not a bad idea. Like it can be really helpful to have something to look forward to, and otherwise it can just be another night of watching RuPaul's Drag Race reruns. Which, yes, that's what happens in my house. I'm not kidding. This is like calls. I'm like, wow, it's been like a while. What have we been doing? RuPaul, that's what we've been watching. Okay, we need to take the TV out of the bedroom now. Yeah.
That's great. Yeah, no, I mean, exactly. So it's really trying to get to a place where you can plan it and really communicate your needs to your partner about that. And, I think the first step is to maximize all your treatment options so your daily symptoms are well managed as possible. We talk about that a lot in my office, and talk to your doctor if you think your medication side effects are getting in the way of being sexy. If you've got a great relationship with your doctor, depending on who that provider is. So that's one thing that I really do cover quite a bit in my office with individual clients, but also with couples that come in. Especially I have like a lot of clients that have RA.
Oh, yeah.
Yeah, and there's one medication that I think like almost all of them are on. It may be methotrexate, I think it's called, and it really causes a lot of stomach issues. And when you've got excruciating stomach pains, it's hard to do anything, right?
Yeah.
And
you also don't want to let go of muscle control generally in those moments either. And I hear you. And like when we talk to, Kiros, my other co-host, he has horrible, horrible stomach problems, especially if he gets anywhere near any things he has food allergies to. And, we've talked openly about that, and, with dating and with like being intimate with someone.
Yeah. Yeah. And, it's interesting because when I have my single clients that come in with chronic illness, we talk about dating and whether they should put it out there right away when they meet someone. Do I tell them on the first date that I've got something like lupus or RA or fibro or any other disease, or do I wait? And I think that creates a lot of pressure when it comes to sex too.
What's your viewpoint on that? Like, at what point do you think people should start like having that discussion?
Well, really, the one thing that I always do as a psychotherapist and a sex therapist is that I really put it on the client. I think one thing that we do is we just review it. And most of the time, they want to talk about it on the first date. They would rather get it over with. That way, if the person is like, hey, that's unfortunate, but I'm going to pass, which I think is completely fucked up. But,
I mean, like, I guess I have a different viewpoint. I've actually like been in a long-term relationship with someone I thought I was going to marry. He was like, you know what? I just can't. I can't do this with you. And I'm really actually like now, like 20 years later, I'm able to go. I'm actually kind of grateful for that honesty, because I was able to go and be free and find someone who was like, oh, okay, so you're a single mom who's disabled with a kid with a college degree that means nothing. That's great. I'll totally take you on. So it was helpful to,
I agree with that
not
too.
have someone who wasn't willing to hang with that.
Yeah. I think it can go both ways. I think that can be pretty empowering, because look what you have now, right? It's like, hey, that did me a service, and I'm able to find someone else. And, and this may sound cheesy or whatever, but I really do feel like there is always someone out there for us. I really do believe that. And my clients find that.
I have no idea if that's true or not, because I don't want to discount the people who want to be single and who are not, like, who are like,
exactly.
Hey, I'm asexual. I don't know.
Asexual people.
And that's cheers to that too. But what I will say is, if you have a lot against you in the dating universe, it's actually easier, I found, to date. Like, my friends who are like absolutely ridiculously studying, have everything going for them. They have the most nightmarish relationship dating experiences. And my dating experiences was like someone going, oh, so you're a single mom and disabled. Yeah, no, I'm going to pass on that. And then like the 2 or 3 people are like, you know what, you seem like a really sarcastic bitch and I enjoy that. They ended up being decent relationships, and that was great. And like it was easier, I found, to just whittle the field down to people who actually gave a fuck. Like,
yes, I think that's great when you can find someone who can be that way, and a lot of my clients are single that I do see, and we process that, and they come in here and they talk about their dates that they're having and the good dates and the bad dates. But what I love about working with people that have pain and illness is that just their resiliency. They come in here and what I love it. I just love it when I hear them say, you know what, I have an illness, but I am not my illness. And I'm still
Mm.
going to put myself out there. I'm going to put on the dating app that I've got a chronic disease. And you know what? And they're finding that people are still messaging them and saying, hey, let's go out still. And they come in here and we process that. And I think that's great when they can find that. And I find that a lot of them, if somebody says, nope, sorry, they always find somebody else or they just keep going. And I think one of the things that I really like to do in my work is really validate. And I think when I validate them, that keeps them going as well. It really is a good place for support when you can be in individual psychotherapy and sex therapy and be able to talk about these things that you can't discuss with other people, and I think that's pretty damn powerful. But if you are in a partnership, and you're wanting to reclaim sexuality, it's communicating with your partner about what brings you pleasure, but also what hurts you during sex. It's having that conversation. And
Let's see. Ehlers-Danlos. I don't know anything about that. What? I dislocate by pointing at things. Yes, I hear you there.
Yeah.
But also,
yeah.
when you're talking about doctors, I would also throw in your physical therapist. If you have a physical therapist, they might even be a better person to have a discussion with than your doctor about this kind of thing, because they'll tell you what pillows to use and what positions to put the pillows in, and like how to brace. Well, for me, brace everything. But just sometimes physical therapists could be even a better resource because they know how the joints move and how the body moves and what your muscles might need.
That's a great point. I agree. I think that's wonderful. And, a lot of people out there that have a lot of chronic pain, they've got those physical therapists. So that's a great resource, someone to talk to about that. And if you are in a partnership, I often find that when you're in pain, it affects you and your partner. It's not just your illness, it's both of your illnesses. Or if you're in a poly relationship, it's your different partner's illnesses, and being able to come to a place where you can talk about that. Sometimes you don't want to be touched because there's fear. And I think a lot of times I've heard from other partners that they're afraid to touch their partner because they don't want to cause them pain. So then we start to see this withdrawing and isolating.
Yeah.
And so we bring that into the space too, and we talk about that too, which I think can be helpful. And when do you decide to touch? And where do you touch? And what's pleasurable? Sometimes my clients are like, well, I don't want to be like a teacher. And I'm like, yeah, but that can be kind of hot.
That's your own little kink there, my friend.
You can get a little creative. I always tell partners, get creative with your sex and get curious about your partner. And I think that can be a great thing when two people can come together and talk about that and checking in with each other. One of the things that I have couples do is that they will come into the space and we'll talk about, when did you check in with each other? What did you discuss? What were some of the issues that did come up? Were there no issues? Sometimes people come in here and they talk about great things that are going on. And I think we also need to mention that some folks that have chronic illness, they don't have an issue with sex. Right?
I hear that one. But I do want to take a minute for the people who do. I know we're going to be next time we talk, we're going to have a really serious topic about sexual assault and PTSD, and coming through that again with a healthy, with a more open idea of sex afterwards and how to function with that. Yay, that was a whole mouthful that I really could not get through, and I have not had coffee yet. So I'll keep trying to go. So we also live here in the United States where there's a lot of taboos around. As much as we put sex in every motion of our media and visuals, we have some of the most prudish, very hung up ideas. How do you help people who are dealing, and I don't want to go too far into the sexual assault and the PTSD, but because we're going to really cover that in a week or so, but I really want to see
Right.
how do you talk to your partner if you are a person who is I'm really shy about this. I don't even know how to explore this. I haven't even started exploring myself yet.
Yes,
how do you get through that?
Thank you for mentioning that. So one of the things that I always find in my work, it seems like say that a couple comes in and it's two people, there's one that's always what I call a minimizer and one that's a maximizer. We kind of call it like the tiger and the turtle. And sometimes that person that did not get sexual messages as a child, or they did not get sex education, or they may have gotten the good old sex education where you don't have sex until you're married and all those great things. I know when I took family life in school, and when they would tell me you can't have sex until you're married, I wanted to go out and have a lot of sex. Yeah.
I'm glad your reaction was I want to go get married at 13, so that's good.
Right. I got curious about it. And so, but we have a lot of folks that come into the session and they don't know what even brings them pleasure. They don't know how to talk about it. So, again, one word that always comes up for me is safety. It's having a safe place where you're not going to be judged. And I think sometimes people feel that they're going to be judged by their partner if they bring something up, you know? So, one of the things that I do is something called imago dialoguing that comes from imago relationship therapy. Imago meaning image in Latin. So when we're a child, we get these images into our mindset on what life should be. So we develop these imagos. And so the therapy states that we unconsciously pick a partner based on the negative and positive characteristics of our caretakers. And so our partners, what they do is they help or they heal us. And so when someone does not have this sexual education or knowledge of sexual being, the other person in the space can help them do that, and I help guide that. It's really having a conversation about it. But what I also have them do is really engage in self-pleasuring. You know, like, you know, yes, you can do it together, but like both of you on your own touch and kind of feel what's pleasurable to you. And then you have a conversation about it. Another thing that's great too is mindful touching, because sometimes if they have a hard time communicating, they can just engage in some simple touching that really doesn't have to be sexual at all. It's just relaxing to them. And then if they become aroused, then great, they become aroused. So, but that's a great point to bring up because, you know, not everyone that comes into sex therapy or comes into psychotherapy, they don't know what, they're not fully aware of what pleases them.
Yeah.
You know? Yeah.
And like I know that it's like the big cultural joke I hear that boys, you know, they'll go into the shower and you won't see them for 2 hours. But I don't think that if you just look at humor, you understand a lot about a culture, and you'll see that there's very few female masturbation jokes because we've totally discounted the idea that anyone who owns a vagina would be touching it. Like it's just amazing how little, like, I swear to you, I am a 42-year-old woman and I didn't know what the biology was at all of like any parts until I had my period and I got a tampon box at like, you know, and as a teen, like how is this possible that like you go through sex ed and I was in a really liberal hippie area. I still went through sex ed, still did not understand all the different holes, body, like what everything does. And I'm still shocked when I even look at my kids, like when they come home with their sex ed stuff from school and I'm like, oh hell no, we're going to sit down and have a whole discussion. Are you fucking kidding me? This is not even close to the education you need. I'm glad they taught you to use condoms, but we now need to discuss consent. We need to discuss what's pleasurable because I think that's a huge misleading that we do to our like growing up people is that we don't teach them what's pleasurable. They learn what's pleasurable by watching pornography. That is not how you learn how to have sex with people.
That's not how you learn to do it. No, absolutely. That is a whole entertainment. And it's funny, I will have people come into session and they're like, I really want to learn how to fuck like a porn star. And I'm like,
Jesus, no.
I'm like, wait a minute, back up. You know, and you're right. You know, there's one great resource, Monica, that I love following on Instagram, and it's Sex Positive Families, because they talk all about that, about what consent is, what's pleasurable, and how to bring those conversations up with children and with teenagers. And I think it's critical.
So I just want to say one thing real quick as a mom, because I will tell you right now, the second I tried to bring this up to my kids, they both looked at me like walking out the door, like, no, God, no, Mom, please don't do that to me. And that's okay too. And that needs to be respected. And I did absolutely respect it. But you can find some very good books that will very clearly explain everything in a sex positive way to let them be able to explore this on their own. What I'm just trying to get a point across to is that when we leave it to nothing, they find pornography. And pornography tends to show that very unwilling submission to sex is the way to go with that. And that's sexy and hot. And that becomes a thing that like you
becomes
know
ingrained.
your brain develops what it
Yeah,
finds
yeah,
sexual at a very young
yeah,
age,
yeah.
and
It
if that's
sees
what
it.
kids are exposed to, that's incredibly dangerous.
It is. No, I completely agree. I think that's what ends up happening is that there's not the talk about it.
Mm.
And yes, if your child or children or teenager does not want to discuss it, yes, we respect that boundary. But when they
My dogs are not respecting the boundaries of I am on a recording right now. My dogs have no boundaries. Sorry about that, everyone. You're just going to have to deal with the wolf yelling at something outside. A squirrel ran across the road, or we're getting murdered. I don't know which, but something exciting will happen.
hearing trombones and
My God, it's
all
an
that good
exciting
stuff.
neighborhood.
Yeah, it sounds like it. No, but no, those things need to be talked about, and it's okay to have that boundary when they don't want to. But yes, you're right. Finding pornography and learning that way, that is not the way to go. I think it's highly dangerous for children, or really just for anybody, to be honest with you, because of what goes on in that. And I
Yeah.
think that, yeah,
There's definitely some like oh God, Gallup, Cindy Gallup. I love her. She has an entire porn thing that's all done with the idea of consent, hot sexiness that has nothing to do with like enthusiastic consent. That's what I was looking for. It's all about enthusiastic consent. It's really hot and sexy. Please, you're
hmm
interested in pornography and you're like, I do like my pornography. Thank you very much.
yeah,
Awesome. She's definitely a good person to look up on the internet. She has a whole company that has great porn, but also that's respectful and not degrading. So if you're looking for an outlet to learn more about like pleasure, that's a good spot to go to. If you're like, I
right.
don't like watching porn, I don't like being degraded, this is a better place to go see that.
I love it when we share resources. You know.
I used to do photo shoots, and she was one of the guests on a panel I was doing for an event, and I'm like, I love you so much. I want to be your friend.
That's amazing. That's great. So yeah, just communicating, checking in with your partner. Because when you check in with your partner, knowing that you're facing it together, it can go a long way. It goes to helping you rebuild intimacy if you feel like you've lost intimacy. Simply reminding each other that you are still drawn to each other, that we can deal with this in our own way. And I think sometimes it's nice to just validate and to share with your partner what you still find attractive about them and being able to compliment that. I think that's one thing that I really work with couples is that they tend to get that emotional disconnection and then they lose that. And so it's helping them rebuild that too. Sometimes couples have to be emotionally connected before they can have great sex again. If there's this like rupture that's gone on, it's really hard for them to get connected sexually. And so that's one thing that we really do bring up in couple sex therapy when people have chronic pain, chronic illness conditions, and making more often the effort to touch each other in despite of the pain. And I think that's crucial. If we avoid physical touch, I think we miss out on all the things that remind us of how valuable we are. And of course, that's going to depend on each couple. Like for an example, so if I'm doing sensate focus, which is the mindfulness of sex, where you're doing the mindful touching, if someone's got sexual trauma, that's not going to go well, especially in the beginning, because you need to be safe, right? And there are quite a few folks that have that link between, chronic illness and pain and sexual trauma. And that's really critical to point out. When I did my talk in Chicago, I talked about that. It's one of the first things that I did say about mindful touching. If you're involved in a partnership with someone with sexual trauma, you're not going to jump into something like this right away. You've got to be safe. You've got to have your own communication with it. And it was just nice because there were a few people in the audience that treat sexual trauma. So that was good. But simple touch can ultimately help you feel more comfortable about discussing what goes on in the bedroom too. And so it's having that dialogue with each other. And then if you look at adjustment things, some positions may not be comfortable any longer, and you've got to change things up. And we talk about that in sex therapy with couples with chronic pain.
Man, pillows are your best friend, people. Pillows are awesome. Just saying, if you have like muscle or joint pain, you will very much enjoy pillows. You don't have to go super fancy. Just like what's on your bed already can really help.
Yeah, and whether you're with a partner or not, sex toys, they can be great to go to when you're in chronic pain. Not only do they make pain-relieving orgasms easier to reach, but they take some serious strain off of your body.
And if you're not with a partner, that can be super helpful.
Very much so.
Like, you
Very
should
much
not be
so.
not having a sex life if you want a sex life just because there's no one else around.
Right. So, there's different, there's different, there are online shops such as Come As You Are and Good Vibrations that have really good products, and they test products for people with disabilities.
Yeah, I want to do a
And
huge shout out to Good Vibrations. If you're like someone who's like, I don't like the whole like scary sort of aspect of sex shops, Good Vibrations, it is like the most lovely, wonderful, like even their website doesn't feel intimidating. Like it's a good place to start.
yeah, it's excellent. I always refer a lot of clients to that website. And then different like doxy massagers. I mean, different things that people can use is very well. You can plug them into the wall. Massage, they help with strong vibrations, but they can perform the double duty. They're also great for shoulder pain, back pain. They help with loosening your knots, So there's so many other things. That's what I always ask couples, what's in your sexual repertoire? What are other things that you can bring out that can help?
I wanted to go to something real quick,
Yeah.
because we have a very vast listening audience. I'm sure people have very different kinds of relationships and different social norms. So when we're talking about like vibrators and massagers, there's definitely companies that make them in shapes that you would never know they weren't sculptures. Like a quick internet search, and if you have a partner who is very against your sexuality, that's a whole different discussion we can have. But if this is just the only thing you're listening to, you're like, I just need to know how to get off without offending or upsetting my partner, there are things that look like sculptures that you can use that are great vibrators.
Yeah, absolutely. There's all kinds of things. There are vibrators out there that look like animals.
Mm-hmm. There's like literally sculptures. I saw one that was beautiful. I'm like, is that modern? No, that is not modern art. That is useful modern art. My goodness, that's interesting. Wow, what will they think of next?
Yeah, I saw one that was like in the shape of like a dolphin. It was like really cool at the
They have
Woodhall
lots of
Section.
shapes, but like if you want something that's totally like no one would even guess, like seriously, they look beautiful. They almost look like plasticine marble, and they're in this like really pretty shape, and you'd be like, do you put rings on that? Do you put jewelry on? Is that jewelry hold? Is that just like it really is so amalgamous that if you're like the scariest person in your life that is the most judgmental came over and accidentally saw it, or your kids saw it, speaking of scary judgmental people in your life, they would never know. It wouldn't be a thing that would, like,
absolutely.
strike
What was
out.
great is at the sexual health conference, there were like all these vendors there, and there was one table, and they had all kinds of pleasure enhancing products, So you can get very, very creative, which is amazing. And I was telling them about my work, and I was able to get their card, and I can actually I can put their website onto my website for couples that want to get more creative with their sex, or they need to make different sexual adjustments because of pain.
You could do me a huge favor and do the show notes for this episode and just put a list of like websites for people, and I would be so grateful if I could not do the show notes for this.
Yeah, I'll do it. I can totally do it.
I would be so happy. I'm in the middle of finishing my book, and I have both kids home, and I had every joint dislocate, so please help me. That'd be so nice. You said something a while back, and I didn't want to gloss over it because it was such a wonderful point, and it hit like solar plexus, like especially for me when you said that partners need to make the other partner or partners, whatever your thing is in your world, we are super supportive as long as it's consensual and happy. But making the person who's sick feel attractive. And that is one of the hardest things that, I have super supportive, amazing husband who is like the best man I've ever met in my life. And like 80% of his job with me seems to be trying to make me feel pretty again, like with pills that make you gain weight and not leaving your pajamas for weeks on end. It can be really hard to think of yourself as something other than some sort of tuberculosis patient from the Victorian era. So I guess it has its own sexy hotness. Dickens certainly did it well, but you mentioned that, and I just wanted to underline that a bit. If there are partners who are listening, or if you're thinking about how to talk to your partner, that's such an important part of that, is just feeling.
It really is. And what I find is when a healthy partner can say that to their partner who is ill or in pain, it really does go a long way. I find that it can also really motivate them to have great sexual intimacy too, when those things can be brought up. It really does come down to the relationship in terms of communication and how to bring it up. And one thing that I help couples do, they may have a hard time doing it at home. So when they come in here, we do it. And then I give them some homework to do it at home.
Well, give me some ideas. What's some of the homework you have people do?
Well, I have them, what I'll do is I'll put those in the show notes too.
Yay.
There are these sentence stems that you can use, like, I want to talk about this. I feel this way. I love it when you do this. There's like different things that you can just start out with a conversation, and then it can go into a nice dialogue with each other. I do that all the time in here. And then I just stop and I pause and I just ask what each other's feeling as the other person is saying it. And so it gives them that comfort, and then they go home and they try it. Now, there are times where they go home and try it and they're like, yeah, Dr. Phillips, it like went out the window. It did not go well. And so they come back in and then we just review it together, and then we go back out and I have them try it again, and they keep practicing it. And then, because I think a big part of it, if you're doing couple psychotherapy or even individual psychotherapy, if you can, it does take quite a bit of work outside of the session. And, I think in the beginning, some people struggle with that. So just sentence stems are great. And what I'll do is I will include those, because one thing that really does help couples is something that I use called mirroring, where one's the sender and one is the receiver. And so when you send a message, your partner just mirrors it back, or they paraphrase what you say. The reason why I do that is because it helps them be less reactive, and you have to be listening because you have to mirror it back. And then you've got this presence with each other, which really does help. And then, of course, after you both mirror each other, you validate. And when I say validation, you don't have to agree with your partner. That's not what validation is. It's just acknowledging their feelings.
I need to underline that one more time. Validation is not agreeing. It is saying that you have a valid point I've heard. Yeah, that's beautiful right there. That would save so many relationships, so many parent-children relationships. May I tell you, it's like half of like talking to any person you care about that you want to keep in your life. That's underline that one. Say that as a mantra.
Absolutely. We talk about that all the time in here, and I don't think a lot of people, they understand it until they come in here, and I'm like, you don't have to agree. It's just acknowledging their feelings. So,
oh my God, you just solved all of our political problems here in the United States with that. We don't have to, as long as you're not invalidating someone else's existence, we don't have to agree, but we do need to at least be able to have a dialogue where we do not completely discount the other person.
Exactly.
Wow, look at you. You're even in the right place for it.
Yes. And people don't do it enough. They don't do it enough, and they don't know how to do it. And so in psychotherapy, we can teach people how to do that.
I mean, you can solve everything being in Washington, D.C. Just start getting all the politicians in.
I know. I live right around the corner from the White House. I just
You're
need to
hurting me. I can't even hold that in my chest right now. Never mind. Sorry, we're running away from that topic. Run away.
Yeah, we're not going to go to the White House today. We're talking about sex toys. I'm
not even touching that. I want everyone who knows me to be so proud of me that I did not pick that low-hanging fruit. I'm turning around and walking away from that.
Exactly.
Leave me alone.
Yeah.
That's self-control, everyone, right there.
Then after validating, you just empathize. It makes sense to me that you feel that way because...
Okay, quick stop. Define empathize, because it's a very important word, and I don't think enough people understand what it means.
I think with empathizing, validation, it's agreeing with your partner. I mean, it's not agreeing with your partner. It's just validating what they're saying. But empathy, it is validating the feeling that the other partner is having. Mm-hmm. So you're angry. Well, that makes sense to me that you're angry because, I don't know, I forgot to take out the trash yesterday. It's an acknowledgement, but you're also acknowledging the feeling that the other person has. And I think that's critical. And couples, again, they have a hard time doing that. And I find it especially with couples where there is chronic illness or pain, because what happens with chronic illness, it really does consume you. And then when it does consume you, we find that it causes other problems in relationships. And so it's getting reconnected again and being able to talk about, those difficult subjects when it comes to pain or when it comes to the relationship and what's happened. So that's what I do. And I find that it really does help couples get to a place where it creates more intimacy. And, intimacy meaning it's different from sexual intimacy, but having high regard for each other, being there for each other,
Mm.
having each other's back, supporting each other. If you have that foundation, then you're going to have this foundation for sexual intimacy. And that's what I help couples do in my room or my office. And I find that that really helps. Also, just real quick, another great sex toy company, before I forget, is Hot Octopus. They're
Wow,
amazing
good
because
name.
they, they make toys for men.
I'm the mind reels. I just want a
Yes.
hot Cthulhu one. I just my nerdy heart needs a hot Cthulhu sex toy company, but we'll just leave that where it is.
So there's this other podcast called Shameless Sex that I get on sometimes, and one of the hosts, she runs Hot Octopus. That's her company, and so they have a guy braider. It's like a masturbation sleeve that you can actually stick the penis into, where you don't have to use your hands. So if you have like problems with mobility or your hands, like
Wow.
especially when I have male clients with RA, they can actually use this toy or this device to help them with pleasure, and it's great. It's great. I recommend it all the time for men. So I just wanted to share that because I don't want to leave the fellas out or people who identify as male.
No, thank you so much for or people who own a penis. That's how I've been told to phrase this. Is people who own a
Yep.
vagina, people who own a penis, whatever your other qualifiers are. We're just talking about biology with this part of
Yep.
this,
We're
but
talking
yeah, thank
about
you for bringing that
biology.
up.
Yeah, we're talking about biology, and we don't want to use a bunch of binary language, but for folks that
Yeah.
have a penis and for folks that have a vulva, this is for everyone. And so, yeah, we always want to make sure that we talk about that too.
No,
So,
thank you for that because I get very in my head and I honestly don't understand a lot of like the workings of the male body, and that's such an important point. If you have RA or if you have a spinal issue or hell, if you have Ehlers-Danlos and you're a guy, like anything, or I'm sorry, not a guy, but someone who owns a penis, this is all really good information to be able to still be able to have that sex life with or without partners.
yeah, because again, yeah, my book is for couples, but it's also going to be for people who are single, who want to be in a relationship. And I see a lot of single people who have chronic pain and who have disabilities, and they want to have pleasure. I think we have to look at the myths that continue to happen with people with pain and illness that yes, okay, because you're disabled or you have a chronic illness that you're not sexual. And so many people are. And so that's why they come in, they talk to me so they can reclaim that. So it's really great to be able to help people with that.
Well, and
So
not to say that we're trying to like even force someone to want this. Like if you're asexual, cheers, whatever, no worries. But if this
yeah.
is something that you want, like the goal would be that you would eventually like, at least for like my goals, my personal goals with all of this is that I view that time as something that is the one time where my body is not betraying me, not breaking apart. It's the one time where my body actually gets to experience something good, and that's a very rare thing in a body that is constantly falling apart. So it's that was a goal that my healthcare professionals I had set out with, and that's been
I
what
think
for
that's a beautiful goal. I think that's amazing to be able to know that. And I think that's one of the things that I help people with is just, yeah, despite having a chronic illness or having chronic pain triggered by illness, you can still have a sex life and have pleasure. And yes, you're right. Your body is not betraying you at that time. And
the
they're
funny thing is it's been days since they've had barking fits. Like I can't even imagine what's going on out there, but I'm guessing alien invasion.
probably,
Yeah.
yeah.
Serial
I
killers.
mean,
I mean, we've been watching Stranger Things too, so I'm guessing any number of things could be out that door right now.
so you've been watching things, and yeah,
Oh,
could be.
oh, teenager brought like Stranger Things to our door and was like, "You guys need to watch this." And now my husband and I and like the whole family are like obsessed. We watched like the whole season in a few days. It's our big family bonding thing, which probably says a lot of scary things about my family, but it's been bonding.
Yeah, good. Hey, bonding's great.
So
That's
we're
wonderful.
almost at the end of the time. Is there anything else you really want to like make sure we cover while my dog is having a coronary fit?
Well, if folks want to follow me, you can on Instagram at Dr. Lee Phillips and on Facebook at Dr. Lee Phillips. And then also you can also go to my website, www.drleephillips.com. I tend to blog quite a bit about sex and chronic illness. And yes, I look forward to being back again. And I always enjoy coming on here and talking to you. It's been great.
Oh, thank you. I really love. We try to do this monthly, but we both have very busy lives, so we
Yeah.
do try very hard. You can always find us at Invisible Not Broken or on Twitter, Invisible Not BRK. So though it's fun not having that one available. Go to our YouTube channel if you want to see what we look like. We're super fun. Go ahead and see if YouTube keeps this up. I would doubt it. I've gotten slapped on the wrist more times than I can count from YouTube for language and sexual content, which I find hilarious since, yeah, oh well, we'll leave that
Oh,
one
well.
alone for another day. Yeah, please head to the website at the very least because we will have all of these linked because Dr. Phillips will be very kind to me and do my show notes for this. So it'll be much better than my usual show notes. And if you go to the website, you'll find Dr. Phillips, all of what Dr. Phillips just said about how to find Dr. Phillips on social media. There will be a button right at the very top. You can click it to find Instagram, Twitter, all of it right there. So please head over to invisiblenotbroken.com. And I think that's about it. Thank you everyone for listening. Our international audience has been staggering and humbling to me. So I can't even tell you how much I appreciate all of you listening. I can't believe that we are now at about between 10 and 11,000 downloads a month, depending on who's being interviewed, apparently. Oddly, our sex interview stuff usually races us up to that 11,000 number. Go figure. But we don't advertise at all. Zero advertising here on the show. So that's all because you guys are nice enough to share us. So thank you so very, very much for sharing us. We have had a few interesting reviews on Apple iTunes. Seriously, no worries. I love getting reviews, even if they're constructive criticism. But I don't want you guys to not listen because you find my voice annoying. We give a lot of really good information. And if you're like, oh my God, can't deal with you, no worries. I can't change now. I'm too old. But there are a lot of other really great chronic illness podcasts I can't recommend enough. This is not what I ordered. Lauren is a friend of mine. She has a voice like butter. She does not swear. So if that is more your speed, please don't just give up on podcasts with chronic illness. I have other recommendations. You can even email me and I will very nicely email you back anything as long as you're polite to me. All right. Thanks everyone. Have a great week. Be kind, be gentle, and for everything, be a fucking badass.